Consider as a drug all the substances that, when are introduced into the body, generate a change. Some drugs come from plants, fungi, and animals. To them, the human being has had access from early times, such as marijuana or hallucinogenic mushroom. Other drugs, more modern, have a synthetic origin, product of chemical reactions in laboratories. The design of these drugs aims, in many cases, to make them more violent and addictive. Such is the case of heroin and ecstasy. The drugs are divided into two principal groups, the legal and the illegal drugs. The first one are subject to controls and moderation, for example, tobacco and alcohol. Meanwhile, the second one are strictly prohibited and their consumption, sale, and distribution is punishable by the law. For example, cocaine and heroin. There are four types in which the drugs can be consumed. By smoking, that are those drugs that when are born release an intoxicating fumes which are then sucked into the mouth, like tobacco, marijuana, or crack. Orally, that are those that can be taken orally, either in the form of pills, liquids, or paper attached to the tongue. Such is the case of alcohol, ecstasy, or LCD. By injection, that are those that should be introduced directly into the bloodstream using a syringe. For these, such as heroin or morphine. And finally, by inhalation. These either generate natural gases or vapors that can be breathed directly, as with certain types of glue, or in the form of dots that can be inhaled dry, such as cocaine.
Drugs are chemicals that affect the body and brain. Different drugs have different effects. Some effects can cause long lasting or even permanent health consequences. There are different ways a person can take drugs. The effects of the drug on the body can depend on how the drug is delivered. For example, the injection of drugs directly into the bloodstream has an immediate impact, while ingestion has a delayed effect. But all misused drugs affect the brain. They cause a large amount of dopamine to flood the brain and produce a high. Eventually, drugs can affect the way the brain works and interfere with person's ability to make choices, leading to compulsive drug use. Some effects of the drugs on the body are a weak immune system, heart conditions ranging from abnormal heart rates to heart attacks, nausea and abdominal pain, increased strain on the liver, seizures, stroke, mental confusion, and brain damage, lung disease, and problems with memory, attention, and decision making. Drug effects on behavior. Drug abuse affects the behavior and can cause behavioral problems like paranoia, aggressiveness, hallucinations, addictions, impaired judgment, impulsiveness, and loss of self control.
Withdrawal or abstinence occurs because your brain works like a spring when it comes to addiction. Drugs and alcohol are brain depressants that push down the spring. They suppress your brain production of neurotransmitters like noradrenaline. When you stop using drugs or alcohol, it's like taking the weight off the spring. And your brain rebounds by producing a surge of adrenaline that causes withdrawal or abstinence symptoms.
There are four mental and emotional withdrawal symptoms. First is anxiety, that can cause panic attacks, restlessness, and irritability. Then is depression, that can cause social isolation, lack of enjoyment, fatigue, and poor appetite. Then is sleep, that can come with insomnia, difficulty falling asleep or staying asleep, and finally cognitive, poor concentration and poor memory. There can also be physical withdrawal symptoms. In this case, there are six. In the head, you can feel headaches and dizziness. In the chest, you can feel tightness and difficulty breathing. You can have a racing heart, skip beats, and palpitations. You can have in the stomach nausea, vomiting, diarrhea, and stomach aches. In the muscles, you can feel tension, twitches, tremors, shakes, and muscle aches. In the skin, you can be sweating and feel tingling. Alcohol and tranquilizers produce the most dangerous physical withdrawal. Suddenly stopping alcohol or tranquilizers can lead to grand mal seizures, heart attacks, strokes, hallucinations, and delirium tremens (DTS) in high-risk patients. A medically supervised detox can minimize your withdrawal symptoms and reduce the risk of dangerous complications. Withdrawal from opiates like heroin and oxycodone is extremely uncomfortable, but not dangerous unless they are mixed with other drugs. Heroin withdrawal on its own does not produce seizures, heart attacks, strokes, or delirium tremens.
Drugs can produce different pleasant, exciting, and even hallucinogenic effects, but their consumption also causes serious consequences for the health of the user and for the social functioning. Here are some of the consequences. Cardiovascular problems. These substances alter the normal functioning of the heart. Abusing drugs can lead to heart attack, infection in blood vessels, and other cardiovascular problems. Overdose. Overdose can cause nausea, vomiting, headache, and even hallucinations. Altered mood, not only in the long term, but also in the short term, which means that a person can go from being relaxed to feeling irritated and aggressive very often. Respiratory problems. The consumption of drugs causes greater risk to suffer respiratory diseases, such as pneumonia. Side effects of some drugs include pains in chest and lungs. Weakening of the immune system. These substances cause a series of negative reactions in the immune system, which causes consumers to be more susceptible to diseases and infections of all kinds. Addiction. This addiction can cause a person to do whatever is necessary to get the substance, like stealing or having sex for money. And finally, death. Overdose can lead to hospitalization of the patient, coma, and even death.
Social consequences of using drugs. Using drugs can cause your friends and force to give up in activities you used to enjoy.
First, and all of this, you lose friends. If you think the drugs won't affect you in your relationship with friends, you thought wrong. At first, your friends might not be bothered by your drugs use, although they might not want to use them. After a while, they start thinking that you are using too many and they want to do other things while you want to do drugs, and they might not enjoy your company while you're high, and they're not also they might not want to associate with someone who uses drugs or hang out with a group of people who use drugs. When you're high or getting high, you won't be able to do things with your friends like hanging, doing a sport, going to the movies, or just stay and talk. Instead of spending time with your friends will choose to be with people who like to do those things. Pretty soon you'll be spending more time or alone or with other people who use drugs. They're the one who don't mind be around. They don't pass judgment, and besides, now you have more in common with them than with all your old friends. They understand you better. So you might even start lying and stealing to pay for your drug use. No one wants to be around someone like that. Drugs can also cause persons to become paranoid about their relationship, like thinking that their friends are turning against them during uses, might even become aggressive and violent toward other people, even their family and friends. For these reasons and more, drugs can destroy friendship. Don't let them destroy yours. And not also affecting friends, also affecting family. It affects in every single person that is around a person that use drugs.
The drugs not also destroy a friendship, a big lace of love. It also destroy your life. So think it twice when someone offers you just a try.